All right, so this is the third video in the series of blood typing. This is going to be the last one for blood typing. And we're going to talk about mom and baby and some of the adverse reactions that could happen. And so we're going to have to use some of the information from the last video, so hopefully you watch those first. Now there's something where if mom's blood attacks the baby's blood, or mom's antibodies attack the baby's blood, it's called hemolytic disease of the newborn. It's also called erythroblastosis fetalis. And this will be in the notes for my students, but essentially those things, what that means is that mom's blood is essentially attacking the baby's blood as if there was a mismatch, and it's going to cause that agglutination that we mentioned in the last video. And an agglutination is the clumping of the red blood cells. Now this can cause clots, which can be very dangerous, so it throws clots all throughout the baby's bloodstream. Also, the blood cells lyse, leaking hemoglobin into the bloodstream. That hemoglobin can cause renal failure, which is kidney failure. And so that's a dangerous thing there. Now, so how do we avoid this, and what are some of the factors that we talk about? Now, this is not like blood matching, okay? This is not like blood matching. What this is we have mom that has the ability to produce antibodies. Baby doesn't have the ability to produce the antibodies. Mom is never in danger. Let's get that out of the way. Now, it's the Rh factor that we're looking at, okay? If mom is Rh positive, she does not have the ability to make anti-Rh antibodies, so it is never a problem. It does not matter if the child is Rh negative, it does not matter if the child is Rh positive, the child will never make the mom will never make Rh antibodies in that case, which means the child will never be in danger in that case. When we look at an Rh negative mom, if the baby is Rh negative, that baby will never be in danger, because it's same, it's self, right? Self doesn't attack self, self is a match for self, and so we're not donating blood one way or the other, but we're talking about mom having the ability to attack baby. Baby does not have the ability to attack mom, okay, in this case. So, what we have, this is my representation of the baby, by the way, okay, so this is gonna be baby, and so, it's a super creepy looking baby, but that's the baby. And so what we're gonna have is, if mom's Rh negative, the danger comes when there's an Rh positive, or the potential danger comes when there's an Rh positive child. If the Rh positive baby, okay, if the baby's Rh positive, mom has the ability to make anti-Rh antibodies that will attack the Rh antigens of the child. Now, we said that we don't make them right away, so on first exposure, so let's say it's the first, she's never been exposed any other way, shape, or form. This is the first child that she has that's Rh positive, and there's going to be crossover of blood either prior to birth or at birth, and so, or in the birthing process. And so, what's going to happen is, mom is going to become sensitized. She's going to make the anti-Rh antibodies. Is that baby safe? In this case, yes, the baby is safe because mom has not synthesized the anti-Rh antibodies yet to attack with, okay? But let's say the next baby comes along. If the next baby is Rh negative, that baby is still safe despite the fact that mom has anti-Rh antibodies from the previous child. Why is that baby safe? It doesn't have any Rh antigens, so there's nothing to attack. Self never attacks self, okay? So mom is sensitized, baby 2 comes along, Rh negative, that baby is safe. Baby 3 comes along, this baby is now Rh positive like the first child. This baby being Rh positive, what does that mean? It means they have the Rh antigen on the red blood cells, so this child now being Rh positive is in danger. Why? Well, mom made the antibodies from child number 1, okay? So now she has the anti-Rh antibodies, and those anti-Rh antibodies that she made from child 1 will now attack child 3's Rh antigens, okay? And every subsequent child that's Rh positive will be in danger. So think about it this way. Every child after mom becomes sensitized, every child after mom synthesizes the anti-Rh antibodies, every Rh positive child after that first contact is in danger. Now, there's something called RhoGAM. RhoGAM is a shot that they give that what it does is it prevents sensitization. It prevents mom from ever making the antibodies. It does not block them, so let's be clear on this. So, if mom receives the RhoGAM shot prior to birth, and usually you'll get a shot after the birthing process as well, and well, at least if the baby is Rh positive at that point, Rh negative it won't be necessary. But you'll get the RhoGAM shot. So RhoGAM, what it's going to do is, let's say the baby 1 is Rh positive. Mom gets the RhoGAM shot. Mom is not going to make those antibodies, because the RhoGAM shot is going to prevent her from becoming sensitized. It's going to prevent her from ever making the antibodies in the first place, okay? Hopefully that makes sense. Now, baby number 2 comes along. Baby number 2 is Rh positive. As long as mom gets the RhoGAM shot, that baby's safe as well. If mom does not get the RhoGAM shot, that baby is actually still safe because mom has never made the antibodies, but she will then. So baby number 2, Rh positive, she doesn't get the shot. So now she makes the antibodies that can attack the Rh antigens, which means, you know, any Rh positive children. Okay, so baby number 1 safe because she got the RhoGAM shot. Baby number 2 safe because she wasn't sensitized yet, but now has become sensitized and makes the antibodies. Baby number 3 comes along. Baby number 3 is also Rh positive. Is that baby in danger? A lot of people are going to say, well, no, if she gets the RhoGAM shot. But here's the thing. The RhoGAM shot doesn't block, stop, or inhibit the antibodies. It stops mom from making them. So, if mom gets the RhoGAM shot for baby 3, that baby is still not safe because she made the antibodies with baby number 2 when she did not get the RhoGAM shot. Those antibodies are still present. She has still been sensitized. And now she synthesizes antibodies that can attack the Rh positive antigen despite the fact whether she gets the RhoGAM shot or not. That's what I mean by it doesn't stop the antibodies. It stops the sensitization. Once you become sensitized, it's too late for the RhoGAM shot to help. I'm hoping that makes sense. The video has been going long enough, so I'm going to stop there. If you have any questions, let me know. Stay strong. I'll see you next time.